that I give the House its full attention and, as I try to do, answer as many questions as fully as I can. With permission, I'd like to make a further statement on coronavirus. We've done much as a nation to get this virus under control, and so we've been able to restore so much. Just one example, figures today show that radiotherapy services in England have now returned to pre-pandemic levels, and this is good news and will save lives. But as I said to the House on Tuesday, we are seeing some concerning trends, including an increase in the number of positive cases, especially, but not only, amongst younger people. As the Chief Medical Officer said yesterday, we must learn from the recent experience of countries like Belgium, who successfully put in place measures to combat a similar rise in infections. And so today, Mr. Speaker, I'd like to update the House on a number of new measures that will help us to get this virus under control, to make the rules clearer, simpler, and more enforceable. First, Mr. Speaker, we're putting in place new rules on social contact. We've listened to feedback from the public and the police, and we're simplifying and strengthening the rules, making them easier to understand and easier to enforce. In England, from Monday, we're introducing the rule of 6. Nobody should meet socially in groups of more than 6, and if you do, you will be breaking the law. This will apply in any setting, indoors or outdoors, at home or in the pub. It replaces both the existing ban on gatherings of more than 30 and the current guidance on allowing 2 households to meet indoors. There will be some exemptions. For example, if a single household or support bubble is larger than 6, they can still gather. Places of education and work are unaffected. COVID-secure weddings, wedding receptions and funerals can go ahead up to a limit of 30 people. Organised sport and exercise is exempt. Mr. Speaker, these are not measures that we take lightly. I understand that for many, they'll mean changing long-awaited plans or missing out on precious moments with loved ones. But this sacrifice is vital to control the virus for the long term and save lives. And I vow that we will not keep these rules in place for any longer than we have to. Second, Mr. Speaker, we're putting in place stronger enforcement. Hospitality venues will be legally required to request the contact details of every party. They'll have to record and retain these details for 21 days and provide them to NHS Test and Trace without delay when required. This system is working well voluntarily with minimal friction, and it's very effective, but it isn't in place in all venues, and so it's only fair that it's followed by all. We're supporting local authorities to make greater use of their powers to close venues that are breaking rules and pose a risk to public health, and fines will be levied against hospitality venues that fail to ensure their premises are COVID secure. Mr. Speaker, our goal as much as possible is to protect keeping schools and businesses open whilst controlling the virus. The data show that while the cases amongst 17 to 30-year-olds are rising, the number of cases amongst the under 16s remain very low. And we all know how important it is to keep schools open. As the Chief Medical Officers have said, the long-term risks to children's life chances of not going to school are significant and far greater than the health risks of going back to school. The latest data confirm this. And of course, university students will soon be returning. The Department for Education has published the updated guidance for universities on how they can operate in a COVID-secure way. This includes a clear request not to send students home in the event of an outbreak in order to avoid spreading the virus further across the country. If you're a student who's about to return to university or go to university for the first time, then please, for the sake of your education and your parents' and grandparents' health, follow the rules and don't gather in groups of more than 6. Mr. Speaker, our ability to test and trace on a large scale is also fundamental to controlling the virus, as we've discussed in this House many times. The latest data shows that we're doing more testing per head than other European countries like Germany and Spain, and we have record capacity. We've increased capacity by over 10,000 tests a day over the last fortnight. And while there have been challenges in access to tests, the vast majority of people get their tests rapidly and close to home. The average distance travelled to a test site is 6.4 miles, and 90% of people who book a test travel 22 miles or less. We already have more than 400 testing sites in operation. We added 19 last week and plan 17 more this week. However, as capacity has increased, we've seen an even faster rise in demand, including a significant increase from people who do not have symptoms and are not eligible for a test. This takes tests away from people who need them. So if you have symptoms of coronavirus or are asked by a clinician or local authority to get a test, then please apply. But if you do not have symptoms and haven't been asked, then you are not eligible for a test. At the same time, we're developing new types of tests which are simple, quick, and scalable. They use swabs or saliva. They can be turned around in 90 minutes or even 20 minutes. The so-called Operation Moonshot to deploy mass testing will allow people to lead more normal lives and reduce the need for social distancing. For instance, it could mean theatres and sports venues could test audience members on the day and let in those with a negative result. Workplaces could be opened up to all those who test negative that morning. And anyone isolating because they are a contact or quarantining after travelling abroad could be tested and released. We're piloting this approach right now and verifying the new technology, and then it can be rolled out nationwide. And Mr. Speaker, I'm going to depart from my script here because I've heard the naysayers before, and I've heard the people on the other side complain we'll never get testing going. And they're the same old voices. The same old voices. They opposed the 100,000 tests, and did we deliver that? Yes, we did. They're saying, what about testing in care homes? Well, we delivered the tests to care homes earlier this week. They are against everything that's needed to sort this problem for this country, and they would do far better to support their constituents and get with the programme. And I'm looking forward to rolling out this programme and this work, which has been underway for some time already. I'm absolutely determined that we will get there. And if everything comes together, and if the technology comes off, it will be possible, even for challenging sectors like theatres, to get closer to normal before Christmas. Now, finally, Mr. Speaker, the most important thing that each and every one of us can do is to remember the small things that can make a big difference. Hands, face, space. And if you have symptoms, get a test. Hands, wash your hands regularly and for 20 seconds. Face, wear a face covering over your mouth and nose if you're in an enclosed space and in close contact with people you don't normally meet. Space. Always stay 2 meters away from people you don't live with, or 1 meter with extra precautions like extra ventilation, screens, or face coverings. And of course, if you have COVID symptoms, get a test and self-isolate. Mr. Speaker, coronavirus is a powerful adversary, and when called upon, the British people have done so much to blunt the force of this invisible killer. And now at this important juncture, we're being called upon once more to deliver our collective commitment to follow the rules and get this virus under control. And I commend this statement to the House.
Now call the Shadow Secretary of State, Jonathan Ashworth.
I, as always, welcome and grateful for advance copy of the statement, and we welcome the restrictions that the government have imposed, and indeed we would have welcomed them on Tuesday afternoon had he confirmed what was being said on Twitter that morning. We have seen in recent days that cases have risen sharply across all ages, and admissions to hospitals, sadly, are beginning to increase as well. We all want to avoid a second national lockdown. Lockdowns extract a heavy social and economic price on those who are already suffering, and we should remember that today on World Suicide Prevention Day, we must remember the mental health impact of lockdowns as well. So can I ask him particularly, before I go into the substance of his remarks today, particularly about schools, because we've had many examples across the country of classes and year groups of hundreds, possibly thousands now, of pupils starting the new term as they finished the last term, at home and not in education. is it really the policy of the government that if there are 1 or 2 positive cases in a year group, then the whole year group is sent home for 2 weeks? And if so, are parents and carers eligible for sick pay and financial support, given they will have to take time off work to look after their children? Now, Mr. Speaker, we were promised a world-beating test, trace and isolate regime by now. He says we've got one. Well, on Tuesday, I highlighted its performance in finding contacts and the deteriorating performance. He said on Tuesday I had muddled my figures. Full Fact said I was right and he was wrong, Mr. Speaker. So I will leave it to him to judge whether he wants to correct the record or not, but I would rather he just corrects test and trace. In one study, researchers have found that 75% of people with infections did not adhere with self-isolation. I know he is piloting extra support, but we need a system now, urgently, so that those who are low paid and in insecure work can isolate without fear of losing their jobs. We need a system immediately. We've been calling for it for months and months and months, as he knows. And on testing, I mean, he told us a few moments ago to get with the programme, Mr. Speaker. We just want him to deliver testing for our constituents, Mr. Speaker. We've had examples after examples of people being told to go hundreds of miles. In Telford, the borough has been gridlocked because the system has been telling everybody to go to Telford. And yesterday, he was touring TV studios trying to dampen demand, even though he previously told this House in July, this was his quote, "If you have symptoms, if in doubt, get a test." That's what, if in doubt. He was telling people to get tests, Mr. Speaker. So having encouraged people to get tests, and with 8 million pupils returning to school, with thousands going back to workplaces, as his Prime Minister has insisted upon, surely it was obvious there would be extra demand on the system, and why didn't he plan extra resource capacity to process tests? It isn't the fault of ill people asking for tests, Mr. Speaker. It's his fault for not providing them. And we had no apology today to our constituents who have been told to travel hundreds of miles for a test. And having failed to provide the tests that people need, and by the way, having failed to provide wider diagnostic tests, the waiting list for diagnostic tests has hit 1.2 million today. That's the highest on record. He now wants to deliver 10 million tests a day as part of his so-called Project Moonshot. Now, I've long been pushing him for a strategic mass testing regime from the start. The World Health Organization told us to test. But we are all fed up of undelivered promises and world-beating. Mass testing is too important to become another failed project. It's all well and good, him talking about moonshots and the Prime Minister telling us we'll be tested every morning. Even better would be simply delivering the extra testing that is needed now, not just headline figures. So I have some very specific questions. First of all, the Prime Minister told the nation he wants this in place by spring. The Chief Scientific Advisor pointed out it's completely wrong to assume this is a slam dunk that can definitely happen. So how quickly will this be delivered, and how quickly will the pilots in Salford and Southampton be assessed? Secondly, what is the cost? According to the British Medical Journal, leaked documents suggest the cost will be 100 billion. Is this correct? If it's not correct, can he tell us what his estimate is of the cost of processing 10 million tests a day, and can he tell us how much has been allocated to Project Moonshot? Thirdly, who will deliver it? There are universities piloting projects, like University of Leicester, who are rolling out LAMP testing. What discussions has he had with them? But it's reported that he has already signed agreements and understandings for this project with GSK, Serco and G4S to deliver this. What procurement processes have been undertaken, and can he tell us if that is correct? Fourthly, what are the priorities? He's still not testing the loved ones of care home residents who are desperate to see relatives. And when will the government actually deliver the routine testing of all frontline NHS staff that we've been demanding for months? Mr. Speaker, effective testing depends on quick turnaround and local access. It depends on effective contact tracing. Given he's not even been able to deliver these basics, how on earth do we expect him to deliver this moonshot?
Secretary of State.
Well, Mr. Speaker, I think that the honourable gentleman was rather better when he was supporting the government action in the first part of his response. And what I'd say to him is, he can't seem to decide whether he's in favour of more testing or whether he's against it. All we get is complaint after complaint rather than supporting his constituents and the people of this country in our quest to get through this virus. Firstly, on who is eligible for a test, precisely as I said and as he literally read out, if you have symptoms, get a test. But if you don't have symptoms, then you are not eligible for a test unless you've specifically been asked. And yes, if you have symptoms, and if you're in doubt of whether those symptoms are coronavirus or not, get a test. But if you don't have symptoms, don't get a test. It hasn't changed. It's exactly the same. What's changed is the honourable member opposite not knowing whether he's coming or going. And he doesn't seem to understand. That the way you build a huge project like our testing, which is at record levels, is that you back all the horses. He once again complained about businesses supporting us in our rollout of mass testing. Again, this divisive approach is wrong. We support universities to deliver more testing. We support businesses to deliver more testing. We support the NHS to deliver more testing. We don't support the totally confused approach on the benches opposite. He doesn't know whether he's in favour or against of more testing. He asked about the money. £500 million has thus far been allocated to this project, but it's likely that there will be more. And he asked about staff testing in the NHS, where, as he well knows, we follow clinical advice, but we always keep it under review. Finally, he asked about schools, and the policy on schools is that if somebody tests positive, then that bubble does need to self-isolate, and a bubble is defined by those who are in close contact within a school setting. I'd finally, though, like to end on a point on which we strongly agree. This World Suicide Prevention Day, all of us are united in our support for the mental health services that are provided across this country, and our support for all those who are working hard, for those who have mental ill health or who are at risk of suicide. It is a project on which all of us are on the same side and working together to support people.
Chair of the Select Committee.
Mr. Speaker, as someone who has long campaigned for mass testing, I warmly welcome the ambition behind Operation Moonshot and the implied characterisation of the Health Secretary as this country's answer to Neil Armstrong. But 10 million is a huge target, and I wonder whether he could give the House some idea of the proportion of that 10 million that is dependent on new technologies and the proportion that we can get to with existing technologies, because mass testing is so important to getting the country back to running as normal. And whilst we all want those new technologies to succeed, it will be helpful to have an understanding of how much expansion we can expect on the technologies we already have.
That is an extremely clear and strong position from the Chair of the Select Committee. Of course, we're expanding the current technologies. We have a plan, and we're on track for this plan to get to 500,000 tests a day by the end of the next month on the current technologies. On the next generation of technologies, I'm not going to put a figure on it because it depends on the technologies coming off. And the very nature of backing new technologies is that you don't know which ones are going to be verified. This is why we've got so many that are being piloted, so many with whom we're working. We have tests right now in Porton Down being verified. We want this to go as fast as we can. We want this to go as large as we reasonably can, but we do not put a specific figure on it. What we do is put all of our weight and support behind this project, which will have the positive benefits that my right honourable friend so eloquently sets out.
We're heading up to Linlithgow to Martin Day, the SNP spokesperson. Martin Day.
Thank you, Mr. Speaker. Yesterday, we heard the Prime Minister describe his Operation Moonshot as the only hope of avoiding a second national lockdown. Already, some experts have described this mass testing strategy as being fundamentally flawed. So does the Secretary of State think the Prime Minister is gambling on something that the experts feel cannot be delivered? On Tuesday, the Secretary of State failed to answer my honourable friend, the member for Central Ayrshire, when she asked if it would be better to allow tests to be carried out locally and just move the samples around the UK instead of potentially infectious people. As he didn't give an answer then, will he consider this now? And finally, will he join me in welcoming the launch of Scotland's Protect Scotland mobile tracing app yesterday? And what update can he give the House on his own government's plans to release a similar app?
Very much, Mr. Speaker. We've been working with the Scottish Government as well as with the Welsh Government and the Northern Ireland Government and actually governments internationally on an update on the app technology. On the second point that he makes, it's simply a mischaracterisation of the policy. Of course we move samples around the country all of the time. What we want to do is, of course, continue to reduce the amount of distance people have to travel. And as I say, the average distance people have to travel to get a test is 6.4 miles. But I come finally to the first point that he made. Because there were, in the spring, some people who complained about my determination to expand our testing capacity at a record pace. We're hearing some of those voices out this morning again complaining that we want to increase testing. The party, both the SNP and the Labour Party opposite, are making a huge mistake in opposing mass testing. It is an incredibly important tool in our arsenal.
Thank you, Mr. Speaker. My right honourable friend is a great supporter of the UK's businesses and entrepreneurs. In his measures to tackle the virus, can he intercede with his public health colleagues to prioritise the businesses that generate economic growth so that when this is over, we have an economy that's prosperous enough to cash the very generous cheques that we've written?
Well, my honourable friend is absolutely right and speaks with great knowledge, experience and eloquence on this matter. We have to protect livelihoods as much as is possible in the same way that we're trying to protect education as much as is possible. That does mean sometimes we have to take measures that people would prefer not to see on social contact, but unfortunately the measures that the Prime Minister outlined yesterday that I set out in my statement are, in my judgment, absolutely necessary, both to keeping the virus under control and to protecting education and the economy as much as is possible.
Very.
Thank you, Mr. Speaker. There's been a significant increase in COVID cases confirmed in Liverpool in the last week, with widespread community transmission. Yet I've been contacted by constituents with symptoms who are trying to book a test and either can't or are being told to go to Oldham, to Manchester, to Powys, to Colwyn Bay, when there's a testing facility in Liverpool Airport just down the road in the constituency. So can the Secretary of State explain why this is and why there's no availability of home test kits, given there appears to be so much unused testing capacity?
There's, as I said in my statement, there's record testing capacity and most people get tests very close to home. However, we have got this challenge that some people without symptoms who are not eligible for a test have been coming forward. Thus far, I've been reluctant to put a barrier and a strong eligibility check on the front of the testing system because I want people with symptoms to be able to get that test as fast and easily as possible. However, with this very sharp rise we've seen in the last couple of weeks of people coming forward for tests when they are not eligible, that is something that we're having to look at. The key message to her constituents is that these tests are absolutely vital for people who have symptoms, and therefore if you don't have symptoms and haven't been told by a clinician or by a local authority to get a test, then you should not and must not go and use a test that somebody else who needs it should be using.
I understand the recent actions my right honourable friend has taken to limit gatherings to 6 people, and I would encourage everyone in West Bromwich East and the wider West Midlands to follow the new rules. However, does he agree with me that West Bromwich should remain separate from any local lockdown in central Birmingham, given they are 2 distinct areas with varying rates of infection?
Well, of course, West Brom is a distinct area and separate, of course, in its geography from central Birmingham. However, I would caution my honourable friend that we are seeing some sharp rises in cases across many parts of the West Midlands. And so we do take these decisions on a localised basis. We do not take a whole local authority or regional geography in one go, but we do follow the data, and I'll be sure to keep in touch with my honourable friend. She is a very strong advocate for her local area, but sometimes action is necessary.
Okay.
Can I first of all thank the Secretary of State for the new test centre in Wythenshawe Town Centre that opened this week. Can I challenge him though on the consistency of governance around his department? In Greater Manchester, the MEN are reporting that Bolton has been subject to 4 sets of rule changes in the past fortnight. ITV are saying that 74 local authorities have a higher infection rate now than Greater Manchester had before it went into lockdown. Last week, my constituency of Wythenshawe and Sale East that straddles Manchester and Trafford would have been split asunder hadn't the department U-turned. Restrictions in Greater Manchester are not working because infection rates are mushroomed. What is next, Secretary of State?
I've been in contact with the Mayor of Greater Manchester this morning on the question of what we do in Greater Manchester. Of course, the national measures that were announced yesterday will come into force in Greater Manchester. It's very important that people follow them. We took further action in Bolton. The case rate in Bolton was coming down very well, and thankfully before we implemented the rule change to remove some of the restrictions, we were able to act and stop that relaxation from happening, and in fact then had to tighten up. And so I'm working very closely with the councils in Greater Manchester and with and talking to the Mayor, and I'll absolutely take on board his views as well in making sure that we get the measures right. The message to everyone in Greater Manchester is the same as across the country: follow the rules and follow the social distancing, because it's only by doing that that we'll get this under control.
We go to Chair of the Science Committee, Greg Clough.
Thank you very much indeed, Mr. Speaker. The Secretary of State must accept that there is a problem here. Constituents of mine in Kent this week, displaying symptoms of COVID, were advised to go for tests to Bude in Cornwall and Galashiels in Scotland. And this is in a mild September, before the autumn and winter, when people have coughs and colds that may look like symptoms of COVID. And it's no good blaming people who are asymptomatic. I'd be interested if the Secretary of State can say what percentage of people are turning up for testing that don't have symptoms. I think this needs his personal grip. He referred to the need for him to increase testing capacity from 1,000 a day to 100,000 a day. This is an urgent matter. It needs a grip before the autumn bites, the autumn-winter bites. Will he commit by the end of the month to make sure that anyone that has symptoms of COVID can get a test at a reasonable place, convenient to their home?
That is, of course, my goal. It's my goal for that to happen immediately. And the challenge is both to increase the capacity, a subject that my brother and I have discussed at length, and I know he's a strong supporter of. It's also a matter of making sure that capacity is used by the right people. And this is why I am clear about the eligibility for testing. And it's really important that people hear that message, that if you have symptoms, of course, you should get a test. We urge you to get a test because we need to find out if that is COVID for your sake and for everybody's. But at the same time, it is important that people who are not eligible do not come forward for those tests, because otherwise you're taking a test away from somebody who has symptoms. And yes, absolutely, the best, I want to solve this with more, ever more capacity, but I also want to make sure the tests are used by the right people.
We go to Manchester to Afzal Khan.
Thank you, Madam Deputy Speaker. Many of my constituents are incredibly anxious about schools reopening and want to send their children off to school in the knowledge that they are safe. I'm sure the Health Secretary agrees that keeping schools open safely requires a testing infrastructure that is fit for purpose. So can he explain to the House why each school has been provided with only 10 testing kits?
We have very strong protocols on the return to school, and I'm really glad at the success of the policy to get all of the schools back. I would say that's one of the unsung successes of the government over recent weeks, and that is working effectively. The guidelines set out very clearly when testing is appropriate. Again, testing is appropriate for people who have symptoms. Close contacts of people who have symptoms need to self-isolate, not to get a test unless they themselves have symptoms. And the reason for that is because if they got a test, it wouldn't allow them to leave self-isolation anyway because of the risk of false negatives. So that's why we have the policy as it is. We have given each school 10 or more tests so that they can easily use them if in an emergency, and that's been warmly welcomed, I know, by most schools.
Laura Ferris.
Madam Deputy Speaker, a successful return to school in West Berkshire has been matched with a reduction in the availability of testing. I've listened to my right honourable friend this morning, and if there is a reluctance to impose more stringent eligibility criteria, would he consider an order of priority based on, for example, working parents, teachers being able to access tests sooner?
Again, there hasn't been a reduction in capacity in Berkshire or anywhere else in the country. There's been an increase in capacity. She makes a very good point, though, about the prioritisation. The question is how to enforce a prioritisation without putting in place barriers that slow down access to tests for people that need them. And that's something that we're looking at now.
And now we go to Lancashire, to Rosie Cooper.
Thank you, Madam Deputy Speaker. Could the Secretary of State please explain the lack of availability of home testing kits, which has dropped dramatically in, for example, my area of West Lancashire, where very ill pensioners, in the absence of home testing kits, have been offered tests 80, 100 miles away. And also in the assurance he's given, the confusing messages that there are too many getting tested, or if in doubt, get tested, how that deals with the asymptomatic carriers or spreaders. And this is a huge hidden danger. So in the light of his earlier comments, my constituents would genuinely love to get with the programme, get tested where necessary, and stay safe, if only the government's words met their actual experience of the system.
Clarity is that she calls for can be provided as follows. If you've got symptoms, get a test. If you don't have symptoms, if you haven't been asked to go and get a test, then please don't use a test that one of the Honourable Lady's constituents, who she rightly refers to, who needs a test because they've got symptoms, and they may, for instance, as she says, be elderly. That's who the tests are there for. The capacity is expanding, the capacity is building every single day, and we need to make sure we get those tests to the people who need them.
Sean Bailey.
Speaker, and to reiterate the point made by my honourable friend and neighbour from West Bromwich East, equally my communities in West Bromwich West of Wednesbury, Albury and Tipton are in themselves very much unique and diverse, particularly from Birmingham. But can I just ask my right honourable friend, I was very reassured by his reply to my question last week about a sub-level approach to national restrictions. Could he just perhaps confirm to me what that looks like in detail, and in particular where we draw those lines, and that the approach that will be taken in that won't be an arbitrary line drawing process, but a real engagement with local stakeholders?
Well, we consider this the approach to local action on a ward-by-ward level. And for instance, in parts of East Lancashire, in parts of West Yorkshire, we have a ward-by-ward decision. However, that is driven by the data. And so we do have to look at the data across the board, and I do take very seriously the views of the local directors of public health. And there are several parts of the country, including his, where I am concerned about the rise in the number of cases.
And now we go to Bolton, to Yasmin Qureshi.
Madam Deputy Speaker, The lockdown in Bolton will devastate the hospitality industry and affect the physical and emotional health of my constituents. Can I therefore ask the Secretary of State to ensure that my constituents can be tested in Bolton as soon as they require it? And also, could he ask his friend, the Chancellor, to provide more financial assistance to the Bolton economy? The maximum £1,500 for 3 weeks is not enough. It just about pays for one employee on a minimum wage.
Well, thank you, Madam Deputy Speaker. Of course, those who have been on furlough can reapply for furlough, and the Chief Secretary to the Treasury yesterday set out further support that's available for businesses in areas where we've had to intervene. The measures that we've taken in Bolton are strict, but are absolutely necessary, as I set out on Tuesday. And I'm grateful for the Honourable Lady's support for those measures and the discussions we were able to have before they were introduced.
Lucy Allen.
Thank you, Madam Deputy Speaker, and I thank my right honourable friend for his statement, and I very much welcome the exciting progress on developing saliva testing. Outstanding progress has already been made in expanding testing capacity, and my right honourable friend deserves our thanks for his tireless work. Inevitably, this is not without its challenges. Now, on Tuesday evening, hundreds of cars from across the country, and I mean hundreds, from across the country descended on Telford on its testing site, as directed by the booking system. Tests quickly ran out, roads were blocked, people who had travelled from as far away as Cornwall, Stockport and London were turned away, and my constituents were no longer able to access tests in the area, and they in turn were sent elsewhere. Now, what assurances can my right honourable friend give that the error in the booking system that directed so many people to come to Telford has now been corrected? And does he agree that people should not be crisscrossing the country and travelling for many hours to secure a test?
Yes, I absolutely do, and I agree with my honourable friend and her description of the situation, which is that we have built this system at great pace. I didn't know about this example in Telford, although I had heard of people telling me that there's been a lot of people directed to Telford in this instance. In fact, I had a meeting on the problem of people being directed too far only on Tuesday evening after being in this House, Madam Deputy Speaker, and so it is something that the broad problem is something that we are absolutely looking at, and I will go and take away the particular example and find out exactly what glitch caused it.
Munira Wilson.
Madam Deputy Speaker, I note in the statement that organised sport is exempt from the new regulations. Now, we all want life to return to normal, including sport, which is an important sector of our economy. But as things stand, next month, 20,000 spectators are currently scheduled to travel to Twickenham to watch a rugby international. Now, could the Secretary of State help me to understand the logic that if the scientific advice suggests a family of 6 cannot meet with a relative in their garden, why the Prime Minister is saying that the guidance around sporting events, which would see thousands of spectators travelling around the country to stadia, drinking and socialising, is still only under review?
She's answered her own question, Madam Deputy Speaker, because the Prime Minister did announce that programme is under review, and the results of that will be announced shortly.
Harriet Baldwin.
Thank you, Madam Deputy Speaker. Now, we accepted massive restrictions on our liberty in March because we wanted to protect the NHS from being overwhelmed, and we achieved that, and indeed not all the capacity was used. We are now imposing more restrictions on people's liberty. Is the Secretary of State's strategic goal for England, does it continue to be to protect the NHS from being overwhelmed, or has he now gone further, and is he aiming for zero COVID in England?
Madam Deputy Speaker, the NHS, we did protect the NHS all the way through the peak. And the building of the Nightingale's Hospital is something that this country can rightly be proud. We saw the expansion of hospitals in They built that hospital in China in 2 weeks, and lots of people told me we'd never do it here, and then we did it here in 9 days, and I'm very proud of the team who delivered on that. The strategic goal is to keep the virus down. The problem is that if the R goes above 1 and the numbers start going up, they inexorably continue to rise. So it isn't okay just to let it rise a bit. The problem is once it's going up, it keeps going up unless you take action. That's one of the lessons that we've learned. We learnt it in the spring, and then we've relearnt it if you simply compare Spain, France and Belgium, where in Spain and France the curves have kept going up, and in Belgium they took some pretty significant action similar to what we announced yesterday, and the curve has come down again. And so that's why there isn't a trade-off between taking action, even if it is tough action, and protecting the economy and protecting, for instance, the ability to open schools. I hope that that answers her question. We have seen a number of countries around the world announce that they're going for an eradication strategy. Indeed, the Scottish government announced it was going for an eradication strategy, but this virus has shown that it is very, very hard to eradicate, and we want to keep it under control whilst we pursue both the mass testing and then the vaccine to deal with it once and for all.
Sarah Owen.
Thank you, Madam Deputy Speaker. Tomorrow, I'll be at Rowland's Pharmacy in Sundon Park. I'll hopefully be able to get my flu jab if supplies allow. And this year, it's more important than ever to get a flu jab to protect capacity in our NHS. Can the Secretary of State provide an update on the number of vaccines secured for people this winter? And will he guarantee that there will be enough vaccines for all at-risk groups?
The answer to the second question is yes. We are rolling out the biggest ever flu vaccine programme, and we've continued to buy flu throughout the spring and summer, as it was obvious that we needed a much bigger programme than is normal. In the first instance, that will be available to the at-risk groups, including the over 65s and those with health conditions on the flu list, and then we'll expand it to the over 50s, depending on the take-up in the highest risk groups. We set this out a couple of months ago, and the flu jab is coming on stream soon. I was at a pharmacy myself this morning where they're rolling out the flu jab from Monday, and it'll be accompanied by a huge advertising campaign to encourage people to get the vaccine for flu.
Sir Graham Brady.
Madam, from Monday the government is imposing the most profound restrictions on people's personal liberty and family life. Why has there not been a debate and a vote in the House of Commons this week?
Madam Deputy Speaker, I will take away the point that my right honourable friend makes and discuss it further with the business managers. I've come to the House today in order to be able to answer questions on this matter. I take the point that that is not the same as the statutory instrument itself, and it is something that I have had discussions with the business managers on. Inevitably in this, with a pandemic, we do have to move fast from the health perspective, and I'll make sure that I get back as soon as I can to the right honourable gentleman once those discussions have concluded.
Emma Lewbach.
Thank you very much, Madam Deputy Speaker. South Shields is on the watch list. We have a testing station in my constituency, yet people can't get a test at all or are being told to travel with symptoms to the other end of the country. So far this week, the Secretary of State has said it's the fault of young people, it's the fault of schools, it's the fault of holidaymakers. In fact, it's everyone's fault for doing exactly what he asked and trying to get tested. He should show some leadership, own his failures and tell us how and when he's going to rectify this awful mess.
Across the country, the average distance people have to travel is 6.4 miles, and it's really important that the messages from all those who are responsible, and public servants and have strong public voices like she does, in South Shields, across South Tyneside, the North East, and indeed across the country. It is incumbent on us all to repeat the critical public health messages that if you have symptoms, get a test, but if you're not eligible, then please don't use up the tests that are needed for other people.
Mike Wood.
Thank you, Madam Deputy Speaker. Youth organisations like Scouting and Guiding
and sports training clubs are vital for the social development of young people in Dudley South. Will my right honourable friend do everything he can to make sure that these youth organisations and sports coaching can continue for as long as it's safe to do so?
Yes, my honourable friend who speaks so clearly for his constituents and for the young people who enjoy those facilities, he will be, I'm sure, pleased to know that youth groups are exempt from the rule of 6 because they have their own COVID secure guidelines in the same way that schools do, in the same way that organised sport is exempt.
Mambo Sharalambo.
Thank you, Madam Deputy Speaker. In his statement yesterday, the Prime Minister said he would introduce an army of COVID marshals to help ensure social distancing in town centres. So can the Secretary of State tell me how these COVID marshals will be recruited, how much they'll be paid, how they'll be paid for, and what powers they will have?
This programme will be rolled out by the Communities Department. It is because we'll be working very closely with local authorities to make it happen, and we'll publish the details in due course.
Kieran Mullen.
Thank you, Madam Deputy Speaker. I know how hard the hospital and A&E leaders are working at Leighton Hospital to prepare the hospital for winter in the context of COVID, which is why I was incredibly disappointed to see the local Labour Party telling residents that they were not going to get any extra funding to do that. Can the Secretary of State assure my local residents that is not the case, but also agree to meet with me to discuss the issue of much needed longer term investment in the Leighton Hospital site?
Well, I'm very happy to meet my honourable friend who speaks so strongly for Crewe and all of its residents in the need for a high-quality NHS. And Madam Deputy Speaker, of course, my honourable friend is a qualified doctor, and I think during lockdown spent a huge amount of time in hospital working on the front line of the NHS, and I think we should all applaud him for that work. I'm absolutely happy to meet him. He knows with enormous expertise what he speaks of. We're all grateful for his service, and I hope that we can continue to make improvements to Leighton Hospital.
We now go to Swansea to Geraint Davis.
Deputy Speaker, 10% of infectious people are being sent over 22 miles, some hundreds of miles, without contact tracing for testing. So would the Secretary of State agree that the current testing system amounts to also a spreading system for the virus?
No, because the way that testing sites operate are, of course, themselves COVID secure, and we put a huge amount of effort into the infection control procedures at the testing sites. And I just want to reiterate for anybody listening who might have symptoms, who might be worried by some of the things that they're hearing, that the average distance that people go is only 6.4 miles, and 90% of people travel less than 22 miles to get a test. So if you have symptoms, please get a test.
Now we go to Lichfield to Michael Fabricant.
Thank you. My right honourable friend has said time and time again this morning that if you haven't got symptoms, don't go and get tested, because frankly, the antigen test just doesn't work on COVID if you don't have symptoms. But Patrick McLaughlin, a good friend of ours, now in the House of Lords, always used to say to me, if you want to keep a secret, say it in the chamber of the House of Commons. So can I ask the Secretary of State for Health, how can we get this message across with some sort of snappy title, rather like the rule of 6? It's very straightforward. How can we get it across that if you haven't got symptoms, it is pointless and a waste to others if you go and get tested?
Lichfield, I can think of no better way than to get my honourable friend out and about making that case in a socially distanced way, of course. He's quite right. We've got to get the message across in the first instance to members of this House, and I hope we're doing that today. Also, we're making that clear, of course, in the communications around the process of getting a test to ask people if they have symptoms and make clear that they are not eligible otherwise. And we're reviewing what more we might need to do because we've got to use the testing capacity, the record testing capacity we've got for the people who really need it most.
And now we go to Ealing, to James Murray.
Thank you, Madam Deputy Speaker. This morning, the Transport Secretary was unable to say what enforcement powers the Prime Minister's new COVID marshals will have and what their responsibilities will be. So further to the question from my honourable friend, the member for Enfield Southgate, does the Secretary of State know what powers these marshals will have and what training they will have to undergo?
Well, we're giving local authorities more enforcement powers, for instance, to be able to close venues should that be necessary on public health grounds. And we'll be setting out more details of the marshals shortly.
Peter Gibson.
Madam Deputy Speaker, can I ask my right honourable friend what revisions to the technology supporting the booking of testing can be undertaken to more closely match local demand to local supply?
Yes, this is something we work on constantly. It isn't always perfect, as this session of questions attests, but it is something we're constantly working on to try to minimise the distance, frankly, that people travel. And the team, I think, have done a good job of getting that distance down to 6.4 miles, not least with the rollout of dozens a week of new testing sites, but there's always more work to do.
Tracy Braben.
Thank you, Madam Deputy Speaker. The reason why Kirklees has managed to buck the national trend and keep our infection rates relatively stable is the great work they've been doing as a council with government and other agencies. And we've been working really hard in Batley to try and get our restrictions lifted. But coming into what could be a difficult autumn and winter, can the Minister please commit to keep those extra resources, those testing mobile units in our community so that our rates don't then spike and we close down again?
I pay tribute to Kirklees, to colleagues who represent the seats within Kirklees, who've worked across party lines, worked with national and local government joined up together. We have put more resources in. And they will continue for the time being when they're needed. We are, of course, driven by the data, so in a way it would be good news if they weren't needed, because that would mean that the number of cases would have come down. Madam Deputy Speaker, the Honourable Lady represents exactly the sort of approach that we should be taking. We're all on the same side against this virus. It's far better to be constructive, work together in a team effort. That is what the public wants and expects. They don't want sniping from the sidelines like we've seen from the Labour front bench.
Nusrat Ghani.
Madam Deputy Speaker, I welcome my right honourable friend's commitment to mass testing. In a rural constituency like mine in Wilden, mobile testing units such as the one in Uckfield are key, but there seems to be a glitch in the system. A constituent of mine called Colin lives in the village of Fletching and was directed miles away where he could have been directed to the local mobile testing unit. Can my honourable friend make sure that glitch is fixed?
With pleasure.
David Linden.
Madam Deputy Speaker, we know that the Secretary of State is someone who's very fond of technology, and we welcome that. And I wonder if today he will welcome the 160,000 downloads of Protect Scotland. That's the app that's been launched by the Scottish Government. So both myself and my friend from Kilmarnock and Loudon here are tracing. If any of us show symptoms, then that will be shown up. Will the Secretary of State outline when England will be catching up and taking forward a contact tracing app similar to Protect Scotland?
It's a real pleasure to be commended on my enthusiasm for technology. Normally, comments about my enthusiasm for technology are followed by a large but. In this case, I totally agree about the importance and use of technology, and that'll be coming to English pockets very soon.
James Sunderland.
Madam Deputy Speaker, it's inevitable this week with the return of our schools that we've seen an increased demand for testing across the country, not least in my own patch of Bracknell. In true military fashion, what scope is there for flexing or surging resources in at short notice? And indeed, how do we ask for it?
Yes, my honourable friend, of course, is a former military logistics expert, and there are no greater logistics experts in the world, in my experience, and especially my recent experience in this crisis, than the British military. So he knows that of which he speaks. And we are surging, but we're surging particularly into areas where the case rate is higher. And thankfully, in his part of the world, the number of cases remains relatively low.
Clive Afford.
Deputy Speaker, I'm very sympathetic to the idea of mass testing and have been for some time, but what does the Secretary of State say to someone like Professor David Spiegelhalter, who's said that mass testing could lead to hundreds of thousands of false positives, and with the knock-on effect that there was, over 1 million people could be told to self-isolate because they've been in contact with those people. What assessment has the government made of that issue?
Yes, well, I welcome his enthusiasm for mass testing. You might want to have a word with his colleague on the front bench. Of course, the specificity of a test is incredibly important, so that you don't get false positives. There are ways to deal with it, and of course, those are taken into account in the Moonshot programme.
Randall.
Deputy Speaker, as children return to school, there's an understandable anxiety amongst parents and Gedling that they can get ready access to testing if they require it. As the head of Richard Bollington School wrote to me this morning to say that delays and difficulties accessing testing will keep children away from school. Can my right honourable friend assure me that as well as access to testing centres, parents can continue to apply for home testing kits in order to get prompt results?
Well, of course, when somebody has symptoms, then they can apply whether to go to a drive-through centre or to have the home tests that, of course, are available. It's just that the demand has gone up, especially with this demand from those who don't have symptoms. If people don't have symptoms but have been in close contact with somebody who's tested positive, of course, they shouldn't be applying for a test because, as was just mentioned earlier in the debate, the problem is that you may well get a false negative and you need to self-isolate anyway. So we're really clear about who should be getting a test and who is eligible for a test. But in a way, his question demonstrates why mass testing is also so important, so that we can roll out this testing even further. It's funny because the honourable gentleman on the front bench opposite used to be a great supporter of Tony Blair, the former Prime Minister. Tony Blair knows where he says, I am. I mean, maybe he needs to have a word. Tony Blair's a big fan of mass testing. It's a pity that the honourable gentleman on the front bench opposite doesn't know which way he's looking.
Jim Shannon.
Speaker, and I thank the Minister for his commitment to the job in hand. It's all about balance. It's about balance between the health and the scientific approach that's given, but also to ensure that the economy is okay. So can the Secretary of State outline what discussions have taken place with those who have successfully implemented a different type of response to the coronavirus, such as Norway and Sweden? And does the Secretary of State believe that we can also learn lessons and perhaps indeed consider other approaches?
Yes. My honourable friend is absolutely right in raising this question. We're constantly looking across the world at the different approaches. Sweden has unfortunately had many more deaths from coronavirus than Norway next door, so we do look at the difference in approaches. For instance, in this second rise that we've seen across parts of Europe, we're looking at the difference between the response to that second rise from Spain and France and to that of Belgium that I mentioned earlier. So we're constantly vigilant and looking abroad and trying to find the best way to keep the virus under control, but also support education and the economy.
Nathan.
Madam Deputy Speaker, I wonder if the Secretary of State could give some advice to my constituents. One teacher had symptoms on Tuesday, rang for a test, was told to go to Oldham, which is a 160-mile round trip. She opted, because she has a one-year-old child, she didn't want to do that and she was feeling too ill to do the drive. So she opted for a home test, which came, but she hasn't got the results back yet. Another teacher in the same school, her daughter was ill. She has not been able to get any test anywhere apart from it being sent. She still hasn't got the results. The other school has come in this morning whilst I've been sitting here. They've had 20 pupils off with COVID symptoms out of a cohort of 106. One of the parents subsequently rang in to say they tried to book an appointment for their daughter, spent 9 hours online, was offered an appointment in Glasgow. Now, Derbyshire is in the middle of the country. Glasgow is several hundred miles away. She turned this down, which is not a surprise, and persevered and got an appointment today at Burton. She went to Burton-on-Trent. The staff wouldn't carry out the test as the parents don't have a barcode which has still not been received by them. There were 4 booths at Burton. No one else was there using them, only this parent, his wife and their daughter. What do parents do in this situation?
Well, if people have symptoms of coronavirus, then they should self-isolate and get a test. And yes, we've heard of examples, of course we have, of people having challenges getting tests. I'm very glad, though, that in 2 of the cases that my honourable friend outlined, those home tests have been sent. And in the 3rd case, there was clearly a technical problem, given that there was the barcode is emailed to people who supply their email address. But people with COVID symptoms need to self-isolate, and then if somebody gets a positive test result, then their households do have to also self-isolate. These policies are absolutely critical to the control of the virus.
Liz Twist.
Thank you, Madam Deputy Speaker. It's been reported that the coronavirus pandemic is leading to a quieter epidemic in mental health. The amazing North East suicide prevention charity, If You Care Share, say that calls to their helpline have risen by nearly 300% during COVID. And a survey of Samaritans volunteers found that callers across the country are generally more anxious and distressed than before the pandemic. So, can the Secretary of State tell us what plans are in place to support local areas like mine of Gateshead to ensure that support is there before this becomes a crisis?
Yes, absolutely. And the Honourable Lady is quite right to raise this. We are putting more support into mental health services, but there is a challenge, especially people who weren't able to access mental health services during the lockdown, and therefore their condition got worse and more acute. So it's an area that I'm working on closely. I've had meetings with the Royal College of Psychiatrists throughout this crisis. I'd also like to correct or amend a response I gave in a previous exchange about which the Honourable Lady has written to me, when I said that the number of suicides had fallen. The fact is that the number of suicides reported has fallen, but there are concerns about how many were able to be reported because of delays in coroners. And I just want to put on the record my correction to that fact, an acknowledgement of the problems in reporting. And I reported on the figures as fact, but we should report that those figures are the reported facts.
Sir Desmond Swain.
Is there no scintilla of doubt in his mind, occasioned by the growing body of scientific opinion, which questions the interpretation of the data and concludes that the policies of governments, I use the plural, the policies of governments are having an impact worse than the disease itself?
I'm afraid to say I would love my right honourable friend to be right, but I firmly believe, not only based on the clinical advice, but also based on my own analysis of and judgment of the facts and the international comparisons, that it is necessary for the public health of the nation to take actions to control the spread of the disease and to take the firm and now legislative actions that we are. And the reason is that if the virus spreads, we know that it then spreads into the older age group who too often die from this disease. And we also know that it doesn't just go up in a straight line. If you let this disease rip, it goes up exponentially. And that's why, with a heavy heart, I strongly support the extra measures that the Prime Minister outlined yesterday, and the strategy of this government and of most governments around the world to handle this pandemic.
Chris Bryant.
Nobody pretends that this is easy, but there are real problems in the system. The latest figures for test and trace in England are now out, and they're the worst figures since it started. The numbers have actually gone down since last week. That is the fact, I'm afraid. The Secretary of State might not have seen the latest figures. In relation to testing, my constituents have, ironically enough, been told to go to Derbyshire or Aberdeen or Weston-super-Mare or all sorts of places, and considering the fact that we have one of the lowest car ownership rates in the whole of the UK, it's really difficult for many people if you're not allowed to use public transport and you've not got much money, so you can't afford a taxi to go to Aberdeen or Derbyshire, to make it possible to go at all. And the number of times that my constituents, including today, have been told either when they ring or when they use the website that there are simply no tests available anywhere in the whole of the United Kingdom at all. That's a shocking problem that we all need to address. I just hope the Secretary of State would please stop with all the huffing and puffing and simply just get on with trying to solve these problems. Our constituents are really worried that they're not able to do the right thing. And if people stop doing the right thing, then we will lose control of this completely.
Madam Deputy Speaker, that is exactly what I'm trying to do, and I appreciate the tone in which she asked the question. Just to be clear about the data on contact tracing that have just been released, for the number of people who provided details of one or more close contacts, we reached 82.0 of those in the last week up to the 2nd of September, up from 79.9% in the previous week.
Felicity Buchan.
Thank you, Madam Deputy Speaker. Care homes in my constituency are allowing family visits in their gardens. However, they are very concerned that the weather is about to turn. What is my right honourable friend's advice to my care homes?
Well, the challenge of how to keep people in care homes safe is a really tough one. And the reason that it is because visits to care homes are important not only for our well-being and our desire to see our loved ones, but also for the mental and physical health of those who are in care homes. However, we also need to protect them from the disease because they are amongst the most vulnerable to it in the whole of society. There are COVID secure ways to have visits to care homes, including indoors. Again, once we get to a position of mass testing, this is the sort of thing that we will be able to deliver to enhance that support and make that easier. She's quite right to raise it, and it's something that I long to be able to provide a solution to.
Ben Lake.
Deputy Speaker, I agree with the Secretary of State on the importance of mass testing. However, I'm afraid to say that a number of residents in Ceredigion are being directed under the current system to travel much further than the 6.4 mile average that he referred to in his statement. Indeed, they're being asked in some instances to travel as far away as Birmingham, over 100 miles away, whilst we know that Londoners are being told in turn to travel to Aberystwyth to get their tests. My question is a simple one. How does he intend to work with the Welsh Government to address this problem?
Yes, well, the solution, as I've mentioned a few times this afternoon, is to ensure that we continue the expansion of capacity, and as he knows, there's now record capacity in the testing system, at the same time to ensure that it's those who are eligible for tests who come forward to get those tests. And whilst there are some people who have been asked to travel, there are also the vast majority of people who get tests close to home and get the results back very quickly.
Deanna Davison.
Thank you, Madam Deputy Speaker. Whether on vaccines or testing, British scientists have been at the forefront of our efforts against this pandemic. And I'm very pleased that GSK in Barnard Castle are playing their part, working with government in this national effort. But may I encourage my right honourable friend to also consider working with Honeyman Group, also Barnard Castle based, in order to work alongside them. They at the moment have potentially capacity to deliver up to 10,000 tests per day, and I know they're very keen to work with us.
Secretary of State.
Excellent. Well, I'd love to work with the companies that she mentions and work with her on trying to make it happen.
And finally, Alan Brown.
Thank you, Madam Deputy Speaker.
with the 6-person rule not coming in until Monday, effectively this gives people encouragement to have large gatherings up to 30 people in their households over this weekend, which is clearly a risk when the virus is already spreading and increasing at the moment. Also means it's more important that the government's got the best test, track and trace systems in place. Now, as my honourable friend pointed out, the Scottish Government's already got Protect Scotland mobile app up and running, and that's been used by 160,000 people already. Yep. When is he and his government going to have their tracing app in place?
Very soon, and as the UK Secretary of State, I would urge all people in Scotland to download the app. I know that the Scottish Government's app is technically excellent. And I would strongly endorse it, as I will strongly endorse people in England to download the English app, and people in Wales to download the Welsh app, and indeed people in Northern Ireland to download the Northern Ireland app, and support the whole of the UK to do everything that we all can to tackle this problem.
Thank you. Point of order, Liz Twist.
Thank you, Madam Deputy Speaker. Can I first of all start by thanking the Secretary of State for putting some of the records straight about the suicide figures for the first quarter of this year. However, he will know that I'd also asked him to confirm that, in fact, the suicide figures for the last full year, i.e. 2019, have in fact, sadly, risen. And I think it's important that we also get that on the record as well.
Secretary of State.
I'm happy for that to stand on the record, yes.
Thank you. Point of order, Chris Bryant.
It's completely different. It's nothing to do with health. So, but Madam Deputy Speaker, the government announced the business for the next fortnight earlier today. As you know, the Standards Committee, which I chair, has 7 lay members and 7 members of this House sitting on it. We've been missing 2 members because appointments were meant to have made by now. I don't know why the House Commission delayed this for some considerable period of time, but that has been gone through the House Commission now. We still have no sign of the motion before the House for another 2 weeks, it would seem. That makes it really difficult for the Standards Committee to do its job properly. We have important issues to debate and to deal with. I just wonder whether you could kick some shins somewhere in government just to make sure that we get this motion so that these people have been appointed. They're desperate to start the work. It all seems a bit unfair on them.
I thank the honourable gentleman for his point of order. I can't promise to kick shins. I've always found that the use of the stiletto heel works better, but I don't intend to do that either. But I do appreciate the point that the honourable gentleman has made, and he's right to make it in the chamber. I will make sure that Mr. Speaker is aware of his very reasonable concerns, and I'm quite sure that the Treasury bench will let the Leader of the House know of the concerns, I got a nod from the whip, of the concerns of the honourable gentleman. It is vitally important that a committee like the Standards Committee is able to carry out its work properly, and the House ought to facilitate that. Thank you. I will suspend the House for 3 minutes in order to allow people to leave safely and carefully. 3 minutes.